Mental health providers in Augusta today calling on the state legislature to improve behavioral health care support.
They presented a resiliency package. That means several goals for the state of Maine. Healthcare providers also hoping to see expanded access to services through workforce investments, support for best practice models, and more preventative support for young people.
They are sitting on the appropriations table and awaiting funding. These fill major gaps in our system of care that will allow better access to services.
Governor Mills included an expansion of crisis centers as part of her upcoming supplemental budget in Tuesday's State of the State address. Supporters say that's really only one step forward. Meanwhile, Maine Republicans are also responding, agreeing with the governor's goals.
At the State House, a push to pass a slew of bills designed to get more people help for mental health issues here in Maine. Today, mental health providers push for a package of bills that they say will expand access to services. They say since the pandemic, the opioid crisis and a string of tragedies in the state, the need for mental health has doubled. Not only is there a lack of access, there just aren't as many mental health crisis workers as there were in the past. Supporters say, for example, there were 82 statewide 10 years ago in Kennebec County alone. Right now, there are 40.
Somebody's in crisis, and the crisis response workers call and say, we can be there in an hour, maybe two. So they end up in the emergency room, and then they end up stuck there because there's nowhere to step them down to.
Now, these bills would do a number of things, including get more clinicians into the field, help to people who need mental health help because of substance use, expand behavioral health services in schools and homes, and expand the number of crisis receiving centers and services around the state.